Or Queenslanders under 50 who aren't in the Phase 1A or 1B group have been able to have the Pfizer jab. There's a surplus of the vaccine that's about to expire, and people have been walking in off the street to take advantage of the situation. But GPs want to know, why isn't the excess stock being redistributed?
Buried in a corner of the World Wide Web is a thread detailing an apparent loophole in Queensland Health's COVID-19 vaccine rollout. People outside the Phase 1A and 1B group who are under 50 are getting the jab at various hospitals in the southeast. Some had success after filling in the online registration form. Other people are calling ahead to make an appointment. And then there are some who went in without a booking or calling ahead.
Went down to the hospital, literally just rocked up because I'd Googled it, everything like that, couldn't find anything online, but did get confirmation from someone at the hospital that it was a thing. Went straight on down, got straight through.
Ben Parnham is 29 years old with no underlying health conditions. He's not a frontline worker, but he did get his first shot of Pfizer at the Gold Coast University Hospital last week. He's due for his second dose in the first week of June.
Yeah, so it was all a little bit bizarre, really. Like, I hadn't heard anything. It was just on the grapevine that I could go get one. So all very keen to get things back to normal. Thought, yeah, go straight away, get it done.
Almost 200,000 vaccine doses have been administered throughout the Sunshine State, and more than 3.5 million doses dispersed across the country. But Queensland Health has admitted there is a surplus of vaccines approaching their expiry date. In a statement, the health service said, "In the event of unused vaccine that would otherwise be discarded, our hospital and health services may call up available people in their hospitals or in the community to receive a vaccine in order to minimise potential wastage." But in Ben's case, there was no call-up. He found out through a friend of a friend.
It's terrible, if you ask me, to be honest. The fact that no one knows, like not even people in the hospital were 100% sure of who can get vaccinated.
Brisbane GP Dr Ian Williams has been turning people away from his general practice.
I see in the paper they talk about vaccination hubs and mass vaccination hubs. Well, I can tell you at Camp Hill and through all the suburbs of Australia, mass vaccination is going on now in general practice.
200 vaccines have been allocated to the clinic each week, but the demand is there for another 1,800 per week.
The only problem with our mass vaccination is we don't have enough vaccines. So if we could have some of the Queensland Health vaccines redistributed to us, we could do it in the approved manner.
With flu season on our doorstep, Dr Williams is encouraging people to roll up their sleeves. Georgia Simpson, Sky News.